What time are we for? So, hello everyone. I hope you all are doing well. This is Dr. Maitri. I've done my MD Medicine from St. John's Medical College. So today, as we all know, the NEET Super Specialty exam, the medical group, is just around the corner, another 20 days to go. So today we'll be going through what are the most important topics which are required for the upcoming NEET Super Specialty exam. So whom is this for? If you all are a recently graduated medical student who has done their PG recently and the exams have got over just around a month back or 1 or 2 months ago. So this session will be very useful for you all. Also, some of my colleagues who have been working for all this while and who have not found much time for preparation, then you all can go through this video and try to focus on the most important topics which are very useful for the upcoming exam. So what will we be looking at? First, I'll give you all the overview of the exam. Then we'll be looking at the most important and high yield topics. Then we'll look at how the exam is what are the resources that we can use, and some last minute tips and tricks. So just to give an overview of the exam, the NEET SS is happening after a long hiatus. The last exam was in 2023. In 2024, there were a lot of delays. It did not happen. So right now it's happening on March 30th. The 30th of March is the medical group. So the most recent change in the pattern of the exam is that there are 4 groups. One is the medical group, the oncology group, the pulmonology and critical care. So what we will be focusing at is the medical group. So if there are people who are aspiring for the medical oncology specialty or the pulmonology or the critical care specialty, that would not be under the purview of the topic today. So the medical group will be the feeder exam for a lot of other super specialties like gastroenterology, cardiology, rheumatology, nephrology, neurology. So that's what we'll be looking at today. So what is the pattern of the examination? It's 150 question of 2.5 hours. We have a +4 -1. We do have negative marking. And what is the level of preparation that we have to be looking at? So up to 80% of the examination standards is of the MD level itself. And you would be surprised to know that 20% is actually of the NEET PG level, the entrance level examination that we had 3 years back for the MD entrance. So 20% of the questions are at that level itself. The new pattern of examination, which is including all the medical feeder subjects, which is like all of the medical subjects put together based on Harrison's, has been started only from the past 2 years. So 2 years prior to that, in the year of 2021, in the year of 2020, the pattern of examination was slightly different. So the students had to decide which subject that they're opting for, the top 2 subjects, and then study for those subjects in particular. So at that point in time, we had to be very, very thorough with which subject you all are aiming at. For example, if we were aiming at cardiology, then you will have to be prepared for cardiology at the SS level, in the sense that at the INICET cardiology level, you will have to go through all the cardiology super specialty textbooks and be ready. But however, from the past 2 years, with the change in the pattern of examination, what we are beginning to see is that the exam is at an MD level. Meaning to say that if we read the Bible for general medicine, which is Harrison, if you read it thoroughly, you can definitely clear the examination. So the preparation that we need most often is just at the MD level. And also with the 3 years of experience that we've had with the MD examination, it is imperative to say that with that kind of an experience, up to 50% of the question with our background clinical knowledge itself, we can answer. So that is the level of preparation that we will be looking at. So coming to the subjects. So there are 3 giants that we have to focus on, which is neurology, gastroenterology, and endocrinology. So nearly 20 to 25 questions have been asked in the NEET SS 2022 and 2023. So these are the 3 giant subjects that we should be completely thorough with, which is Neurology, Gastroenterology and Endocrine. The other subjects are infectious disease. So as we all know, infectious disease is a very huge subject. So what is the number that has been, or what is the trend that has been from the past 2 years? From infectious disease, hematology and cardio and nephro, we are getting around 15 questions. So we're getting around 15 questions. From rheumat and immunology, we've got around 10. And from pulmonology as well, we've got around 6 to 10 questions. So the giants are done, and infectious disease, hemat, cardio, nephro around 15, rheumat and immunology around 10 questions. And pulmonology, though we do have a pulmonology group separately, but we do expect some pulmonology and critical care questions to be asked in this exam as well, which are usually the basic pulmonology level questions. And a very, very surprising thing that many of us wouldn't be expecting. This list of topics is your what we call as the last resort. So in your last month, like as we are at now, in your last month of preparation, it's very, very important that we focus on these topics, because these topics are often neglected, and these are not topics that we generally sit and study even for the MD examinations or your theory examinations. So this set of topics is your last resort. So you would be surprised to know that from these set of topics, we have around, so from these set of topics, we have around 20 questions. Around 20 questions in the past 2 years have been asked from this set itself. So that is a huge chunk that we have to be focusing on. So from genetics, what are we looking at? When it comes to genetics, what are the kind of questions that I've asked? It is only, not to worry, NEET PG level. So simple questions like what is the autosomal dominant amongst these, or what is the autosomal recessive disorder amongst these, which of these is X-linked, or which of these is a trinucleotide repeat disorder. And also what we should be focusing on is Marfan syndrome, Marfan syndrome or osteogenesis imperfecta. So these kind of questions they have asked many times, especially with respect to the genes. Also what we should be seeing is the pedigree charts. So they might give you a pedigree chart and ask you to identify the pedigree chart. So when it comes to symptomatology, what they are saying is very, very basics, like fever with rash or pain. So consistently there have been nearly 2 to 3 questions which have been asked from pain management, like substance P or the pain pathways. When it comes to poisoning and environment, high altitude pulmonary edema and temperature or heat related disorders or hypothermia disorders. And when it comes to environmental emergencies, this is what they are focusing on. When it comes to poisoning, of course, what is most commonly seen in India? So we have snake bites, OP poisoning, scorpion bites. So these are things that we would have definitely seen in our clinical practice. Also, we do prepare on this for our MD final exam. So this is something that we should be focusing on. And when it comes to the other poisonings, especially heavy metal poisoning and their antidotes, so this is also something that we should be looking at. Biostatistics is also only an MD level entrance. Your NEET PG entrance level questions is what is being asked. I would suggest that if you do have some of your NEET PG notes which were available from before, please brush up through them. They ask the very basics, like what is the type of error, or what is the RCT, what is your odds ratio, in your cohort study, what is your risk ratio. So these are the questions that are usually asked, and including sampling techniques. So very, very basic NEET PG level questions are asked. Around 3 to 4 from past 2 years have been asked. So when it comes to metabolism, I know metabolism is a very, very huge chapter in Harrison's. So I would suggest glycogen storage disorders and porphyria, and especially lipid metabolism. So your familial hypocholesterolemia or other familial causes of hyperlipidemia. So these three, if you can just go through the flow charts which are given in Harrison, or just the names, some of the most important clinical features and the treatment, that would be great. So glycogen storage disorders and lipid disorders is very, very important when it comes to metabolism. Skin and psychiatry. Now, skin and psychiatry is a gamble. So even for this, what we really need to know is only at the NEET PG level. We do not need to know beyond that. So from dermatology, especially what in NEET SS 2022 exam had around 2 to 3 questions. It was the very basics like treatment of acne, and the other question that was asked was of a medium to tough level. But of course, from our NEET PG entrance exam knowledge, we could have answered that. That was your antibody to desmoglein 3 in pemphigus vulgaris. So that was a question asked in NEET 2022. So when it comes to psychiatry, the drugs which are used in the treatment of schizophrenia or bipolar affective disorder, so this is what is being focused on. So this is a very, very volatile section. So if you just focus on the most important things in the last 1 month, especially in the last 15 days, please don't forget to go through all of this. So we'll come to the subtopic wise analysis of the major sections as well as the minor subjects. So what I've done is analyze the past 2 papers, and I've seen what are the type of factual questions that are asked and what are the type of conceptual questions that are asked. So as we all know, factual questions are factual. It is not something difficult, but if you don't know it, you will not be able to answer it because the options that they give will be very confusing. So the factual questions is something that you should be focusing on towards the last leap, that is towards the last 15 days or 20 days. Please go through the facts that you completely forget or you tend to forget. So from bone and mineral metabolism, the most important is, which is consistently asked, is your drugs in osteoporosis. So the newer drugs, the mechanism of action of the drugs, which are the anabolic agents. So these are the kind of questions that are asked when it comes to drugs in osteoporosis. The conceptual questions, hypo and hypercalcemia is something that you cannot afford to miss. The approach to hypo and hypercalcemia, the management. So it is very, very important that we go through this carefully. When it comes to etiologies, especially under hypocalcemia, pseudo-hypoparathyroidism is something that they ask frequently. So it's become an examiner's favorite under your bone and mineral metabolism. Your next most important subtopic would be diabetes. Under diabetes, the kind of factual questions that they ask is the type of MODY, maturity onset diabetes of the young, the types, or even the common associations. MODY type 5 is associated with renal cysts or similar, in so on and so forth, or which enzyme is deficient in which type of MODY. When it comes to the oral hypoglycemic agents, especially every year we are having new drugs which are included in the armamentarium of oral hypoglycemic agents. So that is one of a very important factual question that can be asked. When it comes to your concepts in diabetes, it's very simple, NEET PG level, DKA versus HHS, or the types of insulin, the duration of action of insulin is what is being asked. The next important topic is your pituitary. When it comes to the factual questions that are asked from the pituitary, most importantly, the growth factors and the hormones which are involved in the development of the pituitary, like PIT1 defect, PROP1 defect, and so on, and the syndromes associated with panhypopituitarism. The conceptual questions that have been asked is your prolactinoma and diabetes insipidus. So in your prolactinoma, the approach to prolactinoma, what is asymptomatic macroprolactinemia, and how do you manage your prolactinoma, the drugs which are used. And when it comes to diabetes insipidus, how to differentiate between central and nephrogenic DI, what are the drugs used in nephrogenic DI, and so on. So these are the 4 main topics under pituitary which we should be focusing on. Then obesity. When it comes to obesity, one thing about the facts is definitely the BMI cutoffs in the Asian versus the non-Asian population. That is something that they can test you on. Also the newer drugs and the monogenic obesity syndromes. So there are specific tables in Harrison about the newer drugs and the monogenic obesity syndrome. So the mechanism of action of all of these drugs and all the syndromes, in the last minute, if you read it, it will definitely be worth it. DSD is a completely conceptual topic. If you remember the flow chart very well, the approach to DSD and of course the enzymes and the 3 main types of congenital adrenal hyperplasia and how to differentiate it is something that they will give you as a clinical scenario. So this has been consistently repeated, your approach to DSD and CAH in the form of clinical scenarios and asking you which enzyme is deficient. In your DSDs, again, they might also ask you whether this is an XX DSD or an XY DSD, if this is a gonadal dysgenesis, or if this is an androgen insensitivity syndrome, or is this a Swyer syndrome. So these were the particular clinical scenario based questions that were asked. So if you really just read up your enzymes and the flowchart on your approach to DSDs, you can get through. Adrenal. When it comes to adrenal, a lot of factual questions are asked on pheochromocytoma, the sensitivity and specificity of the test for pheo. Also, they might give you a clinical scenario of pheo and ask you how do you manage it, preoperative management of pheo. And the other very important factual question from pheo is your familial causes of pheochromocytoma, your NF1, your men associations. So there are tables for that as well, which you can go through. Then under your conceptual questions, most importantly, Cushing's and Addison's, your approach and your tests. So that 2 flowcharts that we have for Addison's and Cushing's and Harrison's, every step we have to know very clearly, also with the cutoffs. Like for IPSS, when you do your inferior petrosal sinus sampling, what is the ratio cutoff that is used can also be a very confusing option that can be given. Or what is the next best step that you have to take. So your approach to Cushing's and approach to Addison's is very important. Also, hyperaldosteronism. Under hyperaldosteronism, what we should be focusing on is one thing, the drugs which interfere with the aldosterone-renin ratio, the drugs which interfere with the ARR. Apart from that, also we have to know the approach to a young onset hypertension, right? So they can give us a clinical scenario of a young onset hypertension with metabolic alkalosis and hypokalemia, and they can ask you how to go about with it. When it comes to thyroid, of course, hypothyroidism, but 2 most important questions which are asked from the thyroid is your thyroiditis and Graves' disease, especially on the management of Graves' disease. And when it comes to thyroiditis, how do you differentiate your dicuvirin or your subacute thyroiditis from Graves' disease? Under Graves' disease, Graves' ophthalmopathy, and each and every drug used in the management of Graves' disease, including the newer drugs, are frequently asked. So you should be knowing the disease activity, how to assess the disease activity of Graves' disease, and how would you manage it. Of course, one thing that we cannot forget is your MEN and APS syndromes. These are just 2 to 3 tables in Harrison's. So your MEN types, your genes of MEN along with the loci. And when do you start screening for your neoplasms in each type of MEN syndrome? Also, what are your genes for APS and how do you differentiate between APS, which is your autoimmune polyendocrine syndrome type 1 versus type 2. So these are the most important high yielding topics for endocrine. Endocrine is not difficult if you understand it completely, but there are a lot of facts which you'll have to remember in terms of the genes and in terms of slight differentiating factors, especially in your bone mineral and your MEN and APS. So if you go through these tables, it will definitely give you an edge over others. Now, the second giant is your neurology. So under neurology, of course, we can never omit the strokes. So from our basic MD understanding, we all know what are the types of strokes, approach to stroke, that's all okay. But what we have to focus on here is your management. So starting from thrombolysis, indications and contraindications for thrombolysis, and what are the scores that are used, which are your NIHSS score or your aspect scoring system in your CT scan. So all of these have been frequently asked and they have been asked prior. And also endovascular therapy in stroke is a very upcoming topic. So every year some trials such as the DAWN and diffuse trial, DAWN versus diffuse, or what are the indications for your different types of endovascular therapy has been asked. So it is imperative that we go through that as well. Localization. So localization, especially in your brainstem syndromes as well as your MCA syndromes, is something that we should be looking at. When it comes to your basic clinical neurology level, so at a clinical neurology level, what they usually ask you is your localization, whether it is your MCA, ICA, based on your aphasia and types of aphasia and so on. Factual questions in terms of stroke is basically from your CVT as well as the intracerebral hemorrhage and aneurysms, right? So what is the most common site for intracerebral hemorrhage was asked previously. So this is the type of factual questions that have been asked. The next important, very, very important is your epilepsy. So drugs under this, the drugs which are used in the management of each type of epilepsy, be it a focal onset or a GTCS or a myoclonic seizure. Also, what are the side effects of each drug? The mechanism of action and side effects is a very, very important topic that we should be focusing on, which has been asked multiple times. Under the concepts, they can give you some EEGs. We do not have to know in detail about every EEG, but they can give you a clinical scenario and EEG finding and ask you to find out the diagnosis. Also, juvenile myoclonic epilepsy has been asked once. So, juvenile myoclonic epilepsy, some of the other epileptic syndromes like your West disease or your Dravet syndrome, it is a good to know topic. If you know it, well and good. If you have the time to revise, please do go through it, because they can give you an EEG of hips arrhythmia and ask you the diagnosis. So those are some of the spotters. So management of status epilepticus is very, very important. So please do go through this small flowchart which is given in Harrison's. Then dementia. So when it comes to dementia, the examiner's favorite is your Alzheimer's disease. So if you don't read anything under dementia, one thing that you definitely have to read is your Alzheimer's. So under Alzheimer's, everything starting from the genes and the chromosomes of Alzheimer's and the pathology of Alzheimer's, which domain is involved first, which domain is involved last, clinical features, and very importantly, there are certain new drugs which have come up in the market for the management of Alzheimer's disease. So that is also something that we have to go through. It is already given in Harrison's, like aducanumab. So those kind of things we'll have to be focusing on. And the other thing is your Huntington's disease. And the third most important thing under dementias would be your vascular dementias as well as your frontotemporal dementias. But this will just be some clinical scenario questions and ask you to identify what type of dementia it is. It can be easily done. Movement disorders. Under movement disorders, the most important is your Parkinson's disease. When it comes to Parkinson's disease, you will have to know the symptomatology. Also, it is very important you focus on the drugs used for Parkinson's disease and the atypical Parkinson's. So if we have a table which you have from your prior notes, or if you can read up and make a table how to differentiate between each and the salient features and MRI findings, then it becomes very, very easy to remember. So Parkinson's disease management and your atypical Parkinson's disease is very important under this. Other movement disorders, tremor, chorea, dystonia, the drugs which are used. Under dystonia especially, you have a lot of genes, your dystonia syndromes. So if you have the time, please do go through it and put up a list of various genes, and maybe you can read it for 5-10 minutes every day so that it sticks on. When it comes to headache, migraine is very, very important. The kind of factual questions they ask under migraine is especially centered towards your drugs. The newer drugs, the CGRP antagonists, so that is what they are focusing on. Approach to trigeminal autonomic cephalgias is very, very important conceptual question. So if you just go through that Harrison's table of the 3 different types or the 4 different types of tags and how to differentiate between each. Spinal cord. The very conceptual question that can be asked is your approach. So they might give you the spinal level in a clinical scenario, a spinal level, ask you to find out the vertebral level, or they can just ask you the very, very basics of the approach, that is your etiologies. So they can give you a clinical scenario, ask you if it is because of a copper deficiency, is it because of a vitamin E or a B12 deficiencies, or is this your inherited conditions, is it a HSP, is it a ALS, MS? So clinical scenarios become very, very important when it comes to spinal cord. Also differences between neurogenic and vascular claudications, approach to neurogenic bladder. These are the most high yield topics that we should be focusing on. So when it comes to ALS, all the causes for secondary ALS, the types of ALS, differential diagnosis is very important. Under MS, we most definitely have to know the drugs in MS along with the side effects. So drugs in MS along with the side effects is very, very important, and we should know how to differentiate multiple sclerosis from the NMO-MOG group of disorders. So their characteristic MRI findings, the characteristic antibodies, so all of that is very important. Neuropathy, again the patterns of neuropathy. The conceptual questions that they ask is again clinical scenario based. The patterns of neuropathy, how do you differentiate axonal versus demyelinating, and most importantly GBS, variants of GBS, treatment of GBS. That is very, very important. When it comes to CIDP and MMNCB, they mainly focus on the types and the management. So drugs which are used in neuropathy, the drugs which cause neuropathy, the drugs which are associated with neuropathy is a very, very important box. So that is around a list of 10 drugs. So all of the following cause demyelinating neuropathy except, or all of the following cause axonal neuropathy except. So these kind of questions have been asked prior. Under the approach to element disorders, very, very importantly, the drugs which are contraindicated in myasthenia. The drugs which are contraindicated in myasthenia and the antibodies in myasthenia. Antibodies, and also very, very important table is your congenital myasthenic syndromes. Congenital myasthenic syndromes and their genes. Now that is very daunting when you look at it. There are so many congenital myasthenic syndromes. So if you have time, please do go through it. But in the last 5 days, this is one of the other topics that you should be looking at. And under the muscular dystrophies, of course, the approach will be asked. Duchenne and Becker's muscular dystrophy is the definite. Apart from that, if you are not able to read any of it, at least please go through Duchenne, Becker and myotonic dystrophy. So myotonic dystrophy, the Hatchet facies, what is myotonia, what is the difference between myotonia, paramyotonia? So this has been asked previously. Okay. The third giant is your GIT. So under the liver, apart from the basics of ascites or portal hypertension, the complications of cirrhosis. The complications of cirrhosis in terms of HRS or hepatic encephalopathy is something that basic we should not make a mistake in at all. Apart from that, the conceptual questions are on your autoimmune hepatitis, alcoholic liver disease, your Lilly score, and will you give steroids or not? So what would be the next step? These kind of clinical scenarios have been asked. Wilson's disease, everything starting from the genes to the clinical manifestations, which clinical manifestation appears at which age, which are the drugs for hepatic predominant Wilson's or a neuropsychiatric Wilson's, everything has been tested prior. When it comes to the factual questions, the drugs which are implicated in liver injury, has been asked multiple times. So the pattern of liver injury and the drugs which cause them, basically the definition of DILI, and what are the kind of questions that have been asked is which of the following drugs are associated with a viral hepatitis kind of pattern, or which of the following drugs are associated with a vascular injury to the liver like melphalan. So these kind of questions have been asked. So please do make a list of the drugs which are involved in your liver injury. When it comes to esophagus, endoscopic images are very, very important. They can ask you anything ranging from the basics of your endoscopy, that is which the endoscopy image is given and which part of the GIT it is representing. Is it the ileocecal junction? Is it your upper esophagus? Is it your lower esophagus? And some spotter questions that we should definitely know is like your Barrett's esophagus and infections. Infections, especially your Candida, HSV and CMV, which has linear ulcers, which has vesicular ulcers. So these kind of endoscopic spotters can be given. Also your manometry, esophageal manometry with the graph. If not the graph is given in Harrison. So if you just go through the graph, that's well and good. Also, most importantly, under your esophageal disorders is your eosinophilic esophagitis and your achalasia cardia. So these two things please do go through, because nowadays a lot of interventions are being done. So what is POEMS? What is third space? What is your third space endoscopy? What is POEMS? What is your third space endoscopy? So these two things you'll have to see. When it comes to the stomach, H. pylori, very, very important. What they will ask you is not your basic H. pylori, they will ask you H. pylori resistance. If there is clarithromycin resistance, what will you do? What is load therapy in H. pylori? Also, when it comes to your peptic ulcer disease, what are your types of peptic ulcer and complications? one very important question under the gut which was asked was a factual question. Definition of short bowel syndrome and drugs used. Teduglutide was asked prior. Celiac disease and IBD are very, very important. It is your 3-star topic from this topic of gut, because celiac disease, everything, autoantibodies, approach and management. How do you differentiate celiac disease from sprue, or how do you differentiate celiac disease from other malabsorption syndromes? When it comes to inflammatory bowel disease, everything. So if you just make a condensed table, how do you differentiate Crohn's from ulcerative colitis? So some parts of this table you will know from your NEET PG level preparation itself, but there are some parts which you really need to go and read in between the lines, especially for example your epidemiology and your risk factor associations. Smoking and OCP is a very important risk factor for Crohn's disease. Appendicitis is protective for ulcerative colitis. So these kind of confusing options can be given. Also, your histopathological differences between Crohn's and ulcerative colitis, and which drugs are more useful in ulcerative colitis than in Crohn's disease, and the newer drugs, which is an interleukin 12-23 blocker used, and so on and so forth. So ulcerative colitis and Crohn's, in and out. Also very importantly, there have been instances where they have asked you on the scoring system of ulcerative colitis and Crohn's depending upon the severity, which is your Montreal classification. So that is also something that I would advise you all to go through. Pancreas, when it comes to the pancreas, we have the scores and the classification. The scores which are used, like your Apache scoring system or your Marshall scoring system, Atlanta classification, SIRS scoring system. So each and every scoring system which is used in acute pancreatitis can be asked, and more often than not, they'll give you confusing options in terms of which of the following is not a part of the Apache score or Marshall score, or which of the following is not a part of the BISAP score. So unfortunately, these are very volatile topics. So these are some things that you should read just 4-5 days before the exam, or if you're able to make up small mnemonics to remember, well and good. When it comes to gallbladder and your biliary tract, primary biliary cirrhosis versus primary sclerosing cholangitis is a very important topic. Nutrition is something that we should not forget. From the past 2 years, every paper there has been 2 to 3 questions on the vitamins, which has been vitamin A, which has been vitamin D, which has been Keshan's disease, which is deficiency of selenium, and total parenteral nutrition and refeeding syndrome. So nutrition is very important part of GIT. Please do not omit. Moving on to cardiology. Basics of cardiology, everyone knows. I'm pretty sure all of us here know all the basics very well, but it is very important that we go through the basics well, because if the examiner is going to ask you a question from an easy topic such as the basics of cardiology, which everyone will be knowing at an MD level, they are going to ask you something difficult. So the types of pulse, the JVP waves, especially how do you differentiate between constrictive pericarditis and cardiac tamponade, and ECG, all ECG, basic ECGs, which of these is a criteria for LVH? So these kind of numbers we can easily get confused with. So basics of cardiology, very important. Ischemic heart disease, I would suggest you go through it in and out. More so you focus on the complications, right? They can give you a complication based clinical scenario, ask you if this is a VSD, or if this is a septal rupture, if this is a free wall rupture, is this a papillary rupture? So I would advise we go through that as well. Valvular heart disease, the exams that were there 2-3 years prior, they had a lot of focus on the valvular heart disease management. The echo criteria and some values that are used in the management of AS, MS, MR. So each of those tables are available in Harrison. So the flowcharts we are able to go through just before the exam, that would be great. Cardiomyopathies, most importantly HOCM, they can ask you clinical based scenarios, and the MRI findings in dilated cardiomyopathy versus sarcoidosis, the type of late gadolinium enhancement in dilated cardiomyopathy versus sarcoidosis versus a ischemic cardiomyopathy. So that is something that we should be looking at. The factual questions that they ask is mostly from the genetic forms of cardiomyopathies. When it comes to arrhythmias, definitely we should be knowing the pre-excitation syndromes, atrial fibrillation in and out, CHA2DS2-VASc score, Has-Blood scores, though these are some basics that we already know, this is something they focus on. Torsades de Pointes and pre-excitation syndromes. When it comes to genetic syndromes, Brugada syndrome is a definite must. What they do ask at the NEET PG level is they give you a Brugada pattern and ask us to identify, but here it will be one level higher. They'll ask you the genetic mutations, which channels are involved in your Brugada syndromes, and as well as the congenital long and short QT syndromes. Long QT syndromes, which genes have been involved, is very, very important. There are just 2-3 points that are given, which are the genetic syndromes, especially long QT, what are the predisposing factors. So those 2-3 points, if we go through, that would be great. And of course, pulmonary thromboembolism. So that's about cardiology in a gist. Infectious diseases. Infectious diseases is a very, very vast topic. It is not possible for all of us to go through this in detail. So as far as infectious disease is concerned, the 4 most important things that I would suggest we know in and out is HIV, about the diagnosis, about the management, the newer drugs, post and pre-exposure prophylaxis. There are new drugs which have come up for pre-exposure prophylaxis for HIV. And in the management of tuberculosis, there is a new regimen that has come up, which is your BPALM regimen. So if we are able to go through that, that would be great. Malaria, especially the management of malaria in pregnancy, and how do you differentiate between the different species of malaria, complications of malaria as well, and dengue and viral hemorrhagic fevers, especially dengue, management of dengue. Apart from that, if time permits, these are the most important other infections: leptoscrub, brucella, Whipple's and Lyme's disease. Another very important thing is your infective endocarditis. Very, very important is your infective endocarditis. Please go through the chart which is given in Harrison's on the infective endocarditis, the Duke's criteria, as well as the various antibiotics which can be used. For example, they might give you a clinical scenario of Coxiella and ask you what is the antibiotic of choice preferred. So that is very important that you go through the infective endocarditis chapter in detail. When fungal infections, we are mainly looking at Cryptococcus, Candida. Apart from that, especially in HIV, if it is an HIV patient, you are looking at PCP. In HIV, another thing that I forgot to mention is IRIS and the opportunistic infections, OIs. What are the different types of OIs at which CD4 count? So that is also something that we should be aware of. Pneumonia, after our clinical practice, I'm pretty sure everyone knows how to manage pneumonias, but what they do ask is your CURB 65. CURB 65 has been asked multiple times. Very, very important not to skip is your antimicrobial resistance, because every year new antibiotics are being produced. Antimicrobial resistance, what we have to be looking at is your Ambler's classification. Ambler's classification, the types, and what type of enzymes, what are the mechanisms of resistance, what are the newer drugs, which group of new antibiotics can be used for what, and adult vaccination program. They have been 1 to 2 questions which have been asked in the past from your adult vaccination as well. So these are the main things that we have to be focusing on as far as infectious disease is concerned. Now, hematology is, though we have a separate group for your medical oncology, especially the hematology part of medical oncology is something that has been asked consistently. So definitely our talk will be our malignancies, your AML, ALL, CML, CML, lymphomas. Please go through all the tables on the scoring systems, the prognostic factors, newer drugs, especially in AML. So as far as AML is concerned, your translocations, which of this has a good prognosis, which of this has an adverse prognosis. In lymphomas, we should definitely know the approach, because they can give you a clinical scenario and ask you what is the type of lymphoma, because each of the lymphomas, depending on the origin, they have a different CD4 marker. So the lymphomas with the approach. Multiple myeloma has been asked multiple times. So multiple myeloma has always come in the form of a clinical scenario question. All of the following are used in the management of multiple myeloma except. So multiple myeloma is also another thing that we should not be missing. As far as anemia is concerned, hemolytic anemia, sickle, thal, and the drugs causing G6PD deficiency. So hemolytic anemia is warm versus cold AIHA, sickle and thal. Newer drugs which are used in sickle cell anemia is also something that we should be looking at. Platelet disorders, von Willebrand disease and ITP. And drugs, especially your antifibrinolytic agents, your antiplatelets, if you just brush through the basics of pharmacologies, and NOACs, which of the NOACs can be used in renal failure, which of the NOACs can be used at the age more than 65, age more than 70. So these are all simple things. With our practice, we will be having a fair idea, but if you are able to go through this in the last minute, that would be great. Also, transfusion, especially your blood transfusion related adverse drug reactions. A big table is given in Harrison, so if you just go through that, your immediate complications, late complications, infections, that would be great. Okay. Nephrology. So nephrology, some questions are asked just from the basics of nephrology. So what are the basics that they ask is CAS and hematuria. So CAS and hematuria, and this is your GFR. So GFR based and questions, simple questions, image based questions on your CAST or your approach to hematuria. Conceptual questions, most importantly, we should be knowing about the differentiation between the types of RTA and the inherited syndromes. Your proximal tubule inherited syndromes is some of the concepts that should be very, very clear. Under your bracket of AKI staging, drugs causing AKI, mechanisms, very important. Acute tubular necrosis and ATI, and interstitial nephritis. These are the three main things that you should be focusing on under AKI. When it comes to CKD, in the CKD, what we should be seeing is the stages, the KDIGO stages of CKD and hemodialysis. So some factual questions on hemodialysis, or sometimes even clinical questions like your post HD, what are the complications? So post HD complications, like your dialysis disequilibrium syndrome or some other forms of syndromes. Management of CKD, two most important things is your anemia of CKD and your CKD MBD. The newer drugs which are used in the management of anemia of CKD and your CKD MBD. Glomerulonephritis, again a 3-star topic, is something that we cannot miss. Every pattern, every test, and every clinical scenario every glomerulonephritis can come as a clinical scenario, and also the management of each of these. Nephrotic syndromes, all your definitions, how is your adult onset nephrotic syndrome different from your childhood onset nephrotic syndrome? And very importantly, from your Harrison tables, though it is very easy, what they can ask you is all of the following are causes for secondary FSGS except. So the options can be quite confusing that time. So FSGS and membranous under your nephrotic syndromes. When it comes to transplant, at our NEET SS level, they do not ask too much of your transplant immunology. It is a good to know topic, but definitely infections post-transplant. Also, speaking of transplant, bone marrow transplant under hematology is also very, very important. Bone marrow transplant, post-transplant infections, post-transplant complications. Similarly, renal transplant, post-transplant infections and complications. What happens in your early transplant stage? What happens in your late transplant? So there is a timeline which is given in Harrison's. If you can go through it, that's good. Cystic diseases, the genes for nephronophthisis, genes for medullary cystic kidney disease, very important. Most important is your 2-star topic, which is your polycystic kidney disease. All the polycystic kidney disease complications, what are the clinical features, how do you treat infections in the cyst, which are the antibiotics which penetrate the cyst. So these are the kind of questions that we will be looking at. So I hope till here it has been clear. Rheumatology, I would say, is a 4-star topic, because every year there has been questions from rheumatology, and all you really need to know when it comes to rheumatology is your NEET PG level. What you need to know is at your NEET PG level, but you should be knowing it in and out, because it's very, very scoring. If you know your basics well, and if you know some of the facts well, then you will not miss it. So SLE, RA, SPA are the top 3, along with systemic sclerosis. They can give you clinical questions. How do you differentiate between limited versus your generalized systemic sclerosis? And very, very important are your antibodies in SLE, antibodies in systemic sclerosis, and your myositis associated antibodies. It is a very, very volatile topic. but it is very, very important, right? So if you see systemic sclerosis, all of the following are associated with ILD except, or all of the following are associated with severe tendon friction rubs in ILD except. So that is the reason why we should be knowing the antibodies in and out. In myositis, the latest has been your antisynthetase syndrome, and how do you differentiate between each type of myositis, if not everything, at least how do you differentiate between polymyositis and dermatomyositis, and the classical clinical features. Vasculitis is a very, very clinical topic. They can give you any of the syndromes, be it GPA, EGPA, and how do you differentiate between each. Also IgG4 has been coming up in a huge way. So IgG4 can be a great mimic of Sjogren's and sarcoid. So IgG4, Sjogren's, sarcoid is also something that you should be knowing in and out. So if rheumatology on the whole, if you know it in and out, it can definitely give you an edge over others. Under pulmonology, very, very basic stuff, nothing beyond what Harrison says. ARDS, ILD, and most importantly, there are new guidelines which are not updated in the 21st edition with respect to the bronchial asthma and COPD. So the GOLD 2024 and the GINA 2024 guidelines are out. So the staging also has been the ABE staging. So these kind of new updates, if you go through it, it's around 10 to 15 minutes for each guideline, not in detail. You do get slide sets which are available online. So if you go through it, you will be able to crack any question. Drugs, especially the newer drugs which are used in bronchial asthma, that is something that we should be looking at. ABPA and hypersensitivity pneumonitis. ABPA and hypersensitivity pneumonitis. Cystic fibrosis, just 2 pages. Out of the 2 pages, you have to focus on the genes and the drugs. So at which level of deletion, what drug is used? Is it a potentiator? And so on and so forth. Now, last resort. So this is your last resort. If you are looking at something that which will give you an extra edge over others, because these anyway with our clinical practice, and up to 50% of the questions will be clinical and conceptual, and you can solve it. If you have recently given your MD exam, you can easily solve it with whatever you have learned for your MD exam. So if you have something that can give you an extra edge, it is this list of topics, because this is something that you have to read it in the last moment to remember, right? So from genetics, what we should be looking at is very, very NEET PG basic level questions, which is an autosomal dominant, which is an autosomal recessive, like I had mentioned, which is X-linked, osteogenesis imperfecta, Marfan's, and your pedigree charts. Under symptomatology, you will have to be looking at pain, and under poisoning and environment, I had already discussed. You look at your look at your emergencies like your high altitude pulmonary edema, hypothermia, hyperthermia. Under poisonings is commonly seen in India, snake bite, OP poisoning. And under biostatistics, please do go through your NEET PG notes if you have it. 2 to 3 pages, more than enough. Focus on few calculation related, as well as sampling, types of sampling, normal distribution curve, types of power, and false positive, true positive results, and so on. Skin and psychiatry, I had already discussed. They are very, very basic level question. If at all you have time, please go through the drugs. And for your dermatology, there have been questions which were more frequently asked in your NEET SS 2022. So dermatology, fever with rash, common rashes, and how do you manage certain common conditions like acne. You cannot read everything. So drug reactions, dress syndrome, so all of these are something that you can go through. So the resources that we can have, I think there will be 2 groups of people. Someone who has already prepared well. If you have already prepared well from various apps which are available for NEET SS preparation, well and good. You just have to definitely go through the notes. Please do go through the notes for at least twice if possible, or at least once, because revision is the key. As we have all gone through the NEET PG exam, and similarly we are going through the NEET super specialty exam, Unfortunately, there can be up to 40% of questions which are fact-based, or if they are fact-based, similar to your genetics or similar to your biostatistics, unless you know it, you will not be able to solve it. So for that, you will have to go through your notes again and again. And very, very important, another very, very indispensable resource is your Harrison's 21st edition tables and flowcharts. We cannot go through all the tables and flowcharts in these 20 days that we have. If we can go through at least 60 to 70% of the topics that I had mentioned here before. If you all have not studied anything, you all have just finished your post-graduation, whatever you have studied for your MD exam will hold good. So if you want an extra edge, please focus on the topics that I have shown you and go through the tables and charts that I have mentioned. Right? So in your last lap, in your last 15 days, the most important thing is revision is the key. Please revise your lists, revise your notes, revise all the tables, right? Complete all the last resort topics, and please do not panic. In the last 15 days, please make a strict schedule and definitely follow it. Maintain the schedule and try to revise at least 2 subjects a day. The reason is not to finish the subject, not to feel happy that we have finished 2 topics. Only reason being you can recollect it better as the exam comes nearby. If you have studied cardiology 20 days back versus if you have studied the most important points which have been asked from cardiology 2 days back, you're definitely going to remember what you studied in the last 5 to 10 days, right? So try to do two subjects, so one big subject and one small subject. Or what you have to do is a active recall. So if you're focusing most of your day in a big subject, please do take time in the evening to revise whatever you have learned. Or if you have studied cardiology 2 days back, please do take time to actively recall 2 to 3 days later, so that in your exam also you will be able to recall it. Practice MCQs from wherever be the source. You need to practice at least 30 to 40 MCQs a day, and please do give at least one grand test before your exam. I know there are only 20 days left, but at least one grand test, so that you get the feel of the exam and what is the attitude that you should be having just prior to the exam, right? So this is this is how I would like to conclude. So we have faced many exams. 50% of an exam is what we know, but another 50% is the attitude with which we write the exam. So all the best to all of y'all. So I hope you all do really well. So any doubts, I would be happy to take them. All right then. Thank you. Just a minute. So for infective disease, as far as infectious disease is concerned, we'll not be able to read the entire Harrison's. That's why I've given you all the list.